Good morning. So in really good news today, we've only got one new case. It's locally acquired, but it is a close contact of the two known cases that were in Tarragindi. So that's fantastic news and has been detected in home quarantine. So I think Queenslanders should be extremely happy with that news. I know we were at our meeting this morning, and I know that Dr Young is very pleased. So we have 49 active cases. We've had 16,336 tests in the past 24 hours. Again, that's an excellent result. And 14,961 vaccines were delivered yesterday. So once again, Queensland, great news. And remember, keep using that check-in app, keep wearing your mask, and if you are sick, make sure that you definitely go and get tested. Today, I just want to do a quick shout out to all of our hospital and healthcare workers around the state. They are doing an extraordinary job. And on behalf of all the Queenslanders, I want to thank them for everything that they are doing, whether they are doing the tests, whether they are making sure that people are getting their vaccines, working on the front line, whether they're working in COVID wards or in our hospitals. They are doing a tremendous effort. So can I thank each and every one of you for the extraordinary work that you are doing to help keeping Queenslanders safe. So I'll hand over to Dr Young and then Yvette.
Thank you, Premier. So excellent news today. So one new case, and that was picked up in someone who was in home quarantine for their entire infectious period. They're actually well, they're asymptomatic, and they've been in home quarantine. And they live in the same household as those two cases that I announced a couple of days ago from Tarragindi. So that is very good news. And excellent testing numbers again, so thank you. Please keep that up. If we could just keep up every single time someone develops symptoms, that they immediately come forward and get tested so we can find any outbreaks right at the start. That's extremely important. Thank you.
Good morning, Queensland. Thank you to everyone to continue coming out and getting tested and also getting vaccinated. I also want to thank all of our health workers, all of our pathologists, no matter where they're working in our health system. We are so grateful for the work that they do and their efforts, and particularly we know the risks, whether you're in a COVID ward or not. Every person who might walk into an emergency department with a cough or a tickle in their throat may very well be at risk anywhere in the state, and so we're so grateful for the work that they are all doing, and great news today. This is why we had the quick lockdown. We knew we do this fast, we do it hard. For a short period of time, we're able to contact trace and contain the virus. And I want to big shout out to the public health units in our HHSs and all those contact tracers for the incredible work that they've been doing. In relation to our vaccination community hubs, can I just ask the public to be patient? Yes, we are making it clear that the only walk-ins we'll take are people who are going for their second dose or are a frontline worker. We have to do this until the Commonwealth provides more vaccine supply. We have heard some incidents where people are being abusive to staff because they're not allowing general walk-ins. But we can't do this until the Commonwealth provides more vaccine supply. So please be patient, be respectful. We want everyone to get vaccinated, and when we have enough vaccine, we will make sure every Queenslander who wants to be vaccinated can get vaccinated. Thank you.
Dr Young, given yesterday, given today's results, where are we as a state with this virus at the moment? Where are we positioned?
In a good place. So it is really encouraging to see these results and to see us coming through, but it's a little bit too early to relax quite yet. So we do need to maintain those restrictions that we have in place. So please, wearing masks, I know they're really uncomfortable. Don't know about you, but my glasses continually fog up. But they're so important. We've got them this time. We didn't have them last year. We've got them now, and that helps us. And that helps us get through these things quickly. The other thing is this is the alpha variant that's spreading, which is far more infectious than the initial variants, but not as infectious as the Delta variant. So we do just need to, for the next week, maintain some of those restrictions and, of course, come forward immediately if there's any symptoms, just in case there are still some cases out there.
Just on those restrictions, is there any idea on when the ones on hospitals, particularly visitors, will ease?
Well, I would hope they'll all ease at the same time next Friday week. Yep.
Dr. Young, there's a funeral on Friday for a police officer who was recently tragically killed, Senior Constable David Masters. I understand they can't have a guard of honour. Can you talk about the restrictions that are in place there and why those decisions?
Yes, that's an extremely tragic circumstance, and I know I spoke to the police commissioner and she's working through how to manage that within the restrictions.
How many contacts have been identified now?
Right. So we're now up to 9,827 contacts in total across the 5 outbreaks that we've been managing. So not all of those contacts are still in quarantine and so forth, because we've been going for a while now. But we've had 591 from the airport. We've had 250 from that Virgin issue, 134 minors in the end, with 3,265 contacts related to those 134 minors, and 5,587 related to the Alpha outbreak, which is the restaurant and the Greek community centre. So only the admin centre. Thank you for raising it. I just want to clarify that the Greek Orthodox Community Centre has been extremely helpful, really, really fantastic. And initially we had a broader area of concern, but we've been able to narrow it due to their excellent work with us down to just the admin centre. So that will help there with some of that risk assessment. So we have 5,701 people now in home quarantine and 3,093 in hotel quarantine.
I understand that you with delays in contact tracing. Are people's relief being delayed at all due to slow contact tracing?
No, our contact tracing has been brilliant, and that's what's got us to the position we've got to today. And the thing I'd really like to commend people on is people are doing it themselves. They're looking on our website, looking at the areas that are of concern and immediately going into the portal and letting us know. So it's been a really good job by Queenslanders. This is everyone working together very well.
How often have you used that check-in app to contact people who've been exposed to sites?
Sorry?
How often have you used the check-in app?
All the time, yes, we're using it all the time. And of course it's becoming mandatory from Friday, but most people have it in place now and are using it.
Numbers on the amount of local cases we've had since these outbreaks have started?
Yeah, they're the numbers I've just read out.
I thought they were the contacts.
Yeah, they're the contacts.
How many local cases have been confirmed?
Oh, 25 cases.
Across the 5?
Across the Alpha one. So there was the airport, which was 2 people, Virgin, which was 1 person, and the minors was 2 people, and then the Alpha variant is 25 people.
Could you just clarify for me, flight crews that come in, do they automatically from overseas, do they go into 2 weeks hotel quarantine?
No.
Or do they go to their apartment block? Because I just can't remember where that, the Qatar flight member caught it. Was that
Right.
at the Four Seasons Hotel?
No. So we had a luggage handler at the international airport who probably contracted it through a flight crew member leaving Australia, because they gave it to their partner who happened to work on the Qatar check-in counter, but that's not how they got it.
I'm sorry, I might have meant the Emirates when he came in from Portugal.
Right? No, she acquired it in hotel quarantine.
And then went to the apartment block at Hamilton. where they
After
stayed,
they'd
right?
left
So
quarantine.
all incoming flight crew, international flight crews, spend 2 weeks in hotel.
No. So national protocol is that flight crew who live within 2 hours of their arrival airport, so they have a home and live within 2 hours, so they can go in a private car to their home, they can quarantine at home. International flight crew that are not based in Australia, so they're based overseas, go into hotel quarantine.
The capacity of the hotel quarantine system at the moment that's been
It has been tight, but it's been managed, and there's been no situation that we've run out of rooms.
Yeah, would you be open to, though, giving exemptions to the Queensland-based travellers for this Olympics in Tokyo, giving them exemptions to quarantine at home rather than...
It's a national decision. So AHPPC is working through the next phase going forwards to advise National Cabinet about whether or not it's time to consider different quarantine models.
Has there been an uplift in the number of Queensland health staff who are vaccinated? And are you able to confirm if student nurses, are they included in that 1A vaccination?
No. 1A is those people who work on our COVID wards and people who work at our quarantine hotels and at the international border. So that's all been completed. That's been done. Now 1B is healthcare workers, yes, and right from the start students have been considered part of 1B, healthcare worker students. Yes.
And where are we up to now in terms of vaccination across Queensland Health?
I don't have that percentage.
Hotel quarantine, the woman who escaped hotel quarantine in Cairns, I understand she was getting tested again. Has she tested negative again? Is there any concerns?
She tested negative when she first was picked up, and then we'll just have to test her in a few days.
Just on Sydney, Dr. Young, if and when Sydney lifts its lockdown, will you lift the hotspot declaration immediately as you've done elsewhere?
Well, it depends what happens, whether they remove the total lockdown, whether they leave restrictions, how many cases they've got. There are so many variables there. We'll just have to wait and see. And we'll have to wait and see whether they extend the lockdown.
That Prince Charles case, have they been able to speak to that woman who initially contracted the Delta variant? Is there any suggestions yet as to how that transmission is?
No, there aren't any. No, that investigation's happening now.
And do you know any more about the transmission, on the big floor of the hotel?
Yes, I've announced that previously. So that was a fomite transmission between a known case. So the individual healthcare worker who was involved, the quarantine worker involved, had escorted a positive case to an ambulance to go to hospital, and then went up and tested the case that became positive, and there was a fomite transmission between the two people.
Premier, are you still travelling to Darwin for a face-to-face National Cabinet on Friday?
No, we're doing that by Zoom.
And is that National Cabinet still meant to be looking at women's issues?
We haven't got the agenda through yet, Lydia, so I'll have a look at that.
Because that was first announced that was meant to be discussing agenda candidate, etc.
Yeah, I think because of the situation of COVID, I just haven't seen the agenda yet.
One of Wales has
On the
announced.
funeral for
Yeah.
senior constable
Yeah.
masters, a lot of police are upset they can't do the guard of honour system, they can have football games go ahead. Will you be going to the funeral and do you feel for those officers that
Yeah,
are
look,
upset?
it's a very tragic situation, and my heart goes out to the family, and I've personally asked the Police Commissioner and the Minister to pass on my condolences to the family. The Minister, Mark Ryan, and the Treasurer will be representing the government at the funeral on Friday because I have National Cabinet, and I'll be speaking with the family to let them know that is the reason as well. And sorry, what was the other part of the question? Oh, and in relation to the COVID Safe Plan, look, that's a matter between police and Dr Young, recognising that we are in this situation at the moment.
Premier, one from Wakefield.
Yep.
The rental reforms kick in today. Two of the proposed changes from the government being allowing people to do minor renovations and also taking pets in without approval.
Yeah,
Why
let me
were
just
they-
check it. I thought that was still in the committee stages, so I'll just double check that.
Why were they
Yeah.
annexed from the legislation if they were government recommendations?
Sorry,
Why were they taken out of the changes?
I understand that they're through committee at the moment, but I just need to double check that, Lane.
So you don't
Yeah.
think they're actually into that?
I don't think so, but let me confirm. I'll just double check with the Minister.
New South Wales has announced
Yep.
its lockdown will extend for another week. Do you
Yeah,
think-
we're just waiting to see the update from the Premier, so I think we need to listen to what the Premier has to say in New South
But do you
Wales.
think she's waited too late?
Look, I'm going to watch the press conference. I'm not going to comment on New South Wales situation. My responsibility is to Queenslanders, and we have acted very quickly here.
Why
Fuel
do
prices
you
have-
think that outbreaks are handled so differently from state to state? And do you think
That's a
that
matter for
you're-
individual premiers on the advice of their health officers. I'm not going to be drawn on other states. That's their responsibility. I will look after Queensland.
And do you think you're as accountable
What do you mean, Marlena?
Are you guys accountable in explaining the decisions that are made?
I think we're out here nearly every day during a COVID outbreak explaining to Queenslanders exactly what we're doing and why we're doing it. I think you see that across the nation. It's very concerning. It's very stressful. You know, there's a lot of sleepless nights, you know, and you just want to make sure that, that we do the best for Queenslanders. I don't want to see people on ventilators in our hospitals. I don't want to see what's happening in the rest of the world, but we are in a world pandemic, and I think sometimes we get a little bit relaxed and think everything's back to normal, and it's not normal. It's not going to be normal until everyone has been offered that opportunity to get vaccinated.
What do you want to see discussed at National Cabinet on Friday?
Sorry?
What do you want to see discussed?
I think we're discussing COVID issues. I just have to, and probably the vaccine rollout, Lydia. I just have to get the agenda. I'll update you tomorrow.
Is there anything specific on COVID that you think needs to be addressed?
Sorry?
Is there anything specific?
I think we're going to get continual updates about the vaccination and supply.
Fuel prices have increased a lot in the past couple of days. Do you think the state government's fuel price reporting scheme is actually working?
Well, our reporting scheme is to let the consumer know where the differential prices are across the region. So that's for them to have a look at it. I'm not in charge of setting the prices. The market sets that.
I get that. Do you think the government obviously intervene in this situation with the reporting scheme? Do you think you could do anything more?
I don't think we can do anything more, but at least people can shop around and look where there is cheaper fuel in their local area.
What do you do to try to find cheaper fuel?
Sorry?
What do you do to try and find cheaper fuel?
I go down to my local BP, which I go to all the time. It's just down the road from me at Oxley.
Why not the COVID emergency power if we extend it to April next year? Why not just until December when all adults...
Sorry, I missed the first part of the question.
Sorry, it helped them ask. Why should the COVID emergency powers laws be extended until April next year? Why not just until December when adults should be offered the vaccine?
Yeah, because we're still in a world pandemic, and those laws get reviewed regularly. They get reviewed by the committee. They get talked about in the parliament, and we're not out of this pandemic. We are definitely not out of it. So those powers will stay in place as long as we're in a world pandemic.
Do you think that we'll still be in a world pandemic in April next year if everybody hasn't been on the vaccine?
I don't have a crystal ball, Lydia. Your guess is as good as mine. But what we do need to know is that we need to get the supply of the vaccine, and we need to offer every single Queenslander that chance to be vaccinated. Okay? Thanks, everyone. Have a nice day, Queensland, and thank you to our Facebook Live viewers as well.